I think that for the average person, the risk of flu is far greater than the risk from Ebola.
Yeah.
And I want to take this opportunity to say use good hygiene, cover your cough, wash your hands, you know, and stay home if you're sick, get your flu shot. And I would, you know, I would think that for the general public, that's the message I want them to know is that I am much more concerned about them getting the flu than Ebola. They're not contagious. You can walk by them, and in the grocery store, you're not going to get sick from them. It's once they start to have the headache, the fever, you know, the abdominal pain, that they become contagious. They also become more contagious the sicker they get. So, the people, by the time they're in the intensive care unit and needing dialysis and intubation, they're really sick and very infectious.
Yeah.
But when they're first presenting, you know, say you come somewhere and you've got a fever,
low-grade temp,
or a low-grade temperature. It's not like everybody in the room now is going to get Ebola. It's like, okay, there's time to walk calmly and go be put in an isolated room and be evaluated with person wearing personal protective equipment. But people that they walked by on the way to get to the room are not going to be, you know, suddenly getting sick with Ebola. People do exchange students from other countries, and so we've been in contact with Evergreen State College, with St. Martin's, and with SBSCC, and just saying, you know, are you aware of people that have traveled with any of your programs, or are you aware of people that may be coming from any of the West African countries? And they would be the people who could best talk to you about that. At each place, each hospital, be prepared to house and care for people infected with Ebola. As you already know, you know, the people who get medevaced from West Africa will more than likely, you know, be going up to, now my mind's gone, Harborview. I knew it began with A. But locally, hospitals are preparing, and that would include the Providence system and Capital Medical Center. And
something that's really important, though, because I represent both hospitals, and Providence Centralia is a small hospital, and we don't have capacity to care for patients that are as ill as Ebola patients tend to be. Nor to provide the service that they might need, for instance, dialysis. So our plan is that if somebody presents with symptoms and they've been to West Africa, so they're a positive travel screen and positive screening for symptoms of Ebola, they will be transferred out of the small hospital immediately before getting any sicker, because you want to transfer before you need the service.
The CDC is recommending it, what's called standard contact and droplet precautions.
Standard
contact and droplet precautions. And that would include, there's I have it here because I don't want to forget anything that's in my letter. You will see in other situations where they have also had the fourth precaution is something called airborne, as opposed to, in addition to standard contact and droplet precautions. So airborne would be protecting against the flu, against measles, against tuberculosis. Get your flu shot, wash your hands, cover your cough, stay home if you're sick. And I would also say keep calm and get your information from accurate sources.